Resources for proper assessment. In the community under consideration, there are certain resources that could help assess its needs, strengths, weaknesses, and other necessary details. In particular, the community is extremely homogeneous when it comes to the system of beliefs and values about health. Despite the variety of nationalities and races present in the neighborhood, most of the people share common views on religion and its value in health and life. In addition to that, most of the sample population agrees that caregivers should conduct population health assessments in order to better tend to the needs of the public. All of the above signifies that this neighborhood presents a decent study subject that would allow for a comprehensive community assessment. Summary of the findings. On average, the community is highly concerned about health and well-being. The neighborhood has a number of facilities for active recreation, and many families use them. Above that, families report significant spendings related to prevention and treatment such as pharmacy, sports, healthy food, and so forth. Many perform daily exercises, which lets to characterize the activity level as decent. One of the most significant discoveries was that despite the imbalances in racial representation, the health values of the families in each group were similar. Regardless of certain drawbacks, the community's health seems to be in good condition but requires minor adjustments. Community strengths and weaknesses. The community in question has a variety of strengths that help the individuals in it successfully attain their health goals. For instance, there were no sleep issues registered among the participants of the research. Generally, most of the population was aware of the benefits of good night's sleep and followed a certain regimen. Another important advantage of this community was the understanding of the significance of the individual impact on the health of the local population. Most of the interviewed people identified their ideal health role as a role model for certain healthy behaviors. All the above-mentioned strengths help the community to stay united and face issues as a group rather than a set of individuals and families. Such a situation can be regarded as positive as it promotes a collaborative approach to public health. As for the weaknesses, the community demonstrates a weak understanding of the need to be open and discuss their sexuality issues with a professional and/or members of their family. Most of the interviewed people either refused to answer questions on the subject or preferred to give only general and elusive answers. This problem is rather common and requires comprehensive public education initiatives tailored specifically for this community. Barriers to the implementation of health plans. Certain barriers prevent the population in question from achieving and maintaining the state of health. For instance, a certain number of families demonstrated a lack of sexual awareness and felt no need to speak about their problems in that sphere. That issue could lead to unnecessary complications and tabooing of the topic, which can, in its turn, become a precursor to reproductive health problems. In order to address this barrier, public health nurses need to conduct educational seminars and disseminate learning materials on the topic. In addition, meetings should be focused on swaying the opinions of the community leaders in order to have more effect on other members. Tackling this issue could help resolve misconceptions and avoid complicated health problems in the future. This and many other essays are available at studycorgi.com.